Nerve 6, the abducens nerve. This is a lateral view of the right eye. The abducens nerve runs from between the pons and the medulla in the brain to the lateral rectus muscle. The lateral rectus muscle is the only muscle innervated by the cranial nerve 6. All the other muscles shown in this picture are innervated by cranial nerve 3 or cranial nerve 4. The lateral rectus muscle is an abductor of the eye.
When function is normal in all eye nerves and muscles, the eyes move together with control. When a nerve or muscle is disrupted, there are eye deviations with movement or at rest. Tropia and phoria are terms to describe when the eye deviation occurs. Tropia is a misalignment of the eyes that is always present. Phoria is tendency of one eye to deviate from looking straight ahead when the use of both eyes is not available. ESO and EXO are inward and outward deviations of the eye, and hyper and hypo are upward and downward deviations of the eye. There are 3 tests to use to determine abnormalities in the muscles innervated by cranial nerves 3, 4, and 6. These 3 are the cover test, the cover-uncover test, and the alternate cover test. These tests determine tropia, phoria, and deviations of the eye. The smooth pursuits test can isolate the movements of the lateral rectus muscle and cranial nerve 6. To complete the cover test, the eye is covered for approximately 1 to 2 seconds. As this eye is covered, the uncovered eye is observed for any shift. If the eye does not move, it has a normal response. If the eye moves, it is positive for atropia, which is a misalignment that is always present. The cover-uncover test is similar to the cover test, except the focus is on the covered eye. To complete the test, cover the eye for 10 seconds, then quickly uncover it. If the eye remains fixed, it is a normal response. If the eye shifts, it is positive for aphoria, which is a misalignment that is only present when binocular vision is not in use. The alternate cover test measures both tropias and phorias. To complete this test, alternate between covering both eyes for several seconds. If the eyes do not move and remain fixed at the target, it is a normal response. If the eye deviates, it is an abnormal response. The faster the eyes recover, however, the better the control of the deviation. The final test is the smooth pursuits test. While the previous 3 tests are helpful in determining problems with cranial nerves 3, 4, and 6, this test can specifically test for the abducens nerve. The abducens nerve innervates the lateral rectus muscle, which is responsible for abduction of the eye. To complete this test, have the patient follow your finger back and forth to test this muscle. A complete lesion of the abducens nerve will cause the pupil to look inward because paralysis of the lateral rectus muscle leaves the pool of the medial rectus muscle unopposed. A person with this lesion will be unable to voluntarily abduct the pupil and will have double vision.